40,000 men are diagnosed with prostate cancer in England every year. Radiotherapy can be a highly effective treatment, but radiation can also significantly damage other organs.
Now, the first of 1,000 patients will be given a new gel implant, which acts as a spacer, protecting the rest of the body during treatments and reducing side effects by up to 70%. 7 more from our health correspondent, Matthew Hill.
Alan Clark is in no pain just a few days after his operation.
I feel great, absolutely wonderful, yes. Pleased it's done. Wonderful, you know, it's a wonderful team, we're brilliant, like, you just couldn't fault it. There's no pain to it, it's all natural, lovely.
He first had radiotherapy in 2011, but the cancer returned. This puts him at greater risk of getting side effects from radiotherapy. That's why Mr. Clark's been selected to be the first NHS patient in the UK to be given a hydrogel. 2 syringes are mixed together, and once injected, it sets within seconds like a jelly. It creates a space between the prostate and rectum of just over 1 centimetre.
You can see the prostate is here, this grey area is the prostate, and this bit here down here is the rectum. And we've created this space, this black area in between the prostate and the rectum, and that should mean that the rectum will not get the toxicity from the radiotherapy. This might seem like a small space, but in radiotherapy terms, this small space makes a huge difference to the patient's quality of life in the long term.
A study of over 200 patients in the United States shows that this treatment reduces erectile dysfunction by up to 40%, it reduces damage to the bladder by up to 50%, and damage to the bowel by over 70%. There are around 15,000 men who have radiotherapy from prostate cancer each year in the UK. The NHS Innovative Technology Fund will pay for 1,000 of these procedures over the next year in up to 12 hospitals at a cost of around £2,000 per operation. Once the advantages can be demonstrated, it's hoped everyone will be offered the gel so they can be spared devastating damage. Matthew Hill, BBC News.
We're joined now by the NHS England's clinical lead for innovation, Professor Tony Young. Good morning to you.
Good morning.
This is exciting.
It's really exciting. So the long-term plan for the NHS has set an ambition of how we're going to become a nation that sets the pace, that leads in how we take up the latest, greatest things. But it's not just new gadgets or gizmos. It's new advances in treatment, new advances in diagnosis, like we've seen here with this spacer device. You know, prostate cancer is the commonest cancer affecting men, and often they're embarrassed to come forward. Recently, we've had some celebrities trying to promote this, Stephen Fry and Bill Turnbull, trying to encourage men to go and get themselves checked. But actually, sometimes men are concerned about the side effects of treatment. So this new gel, which helps lift part of the bowel off the prostate gland so it's not caught in the radiotherapy field, as we've heard, can reduce quite severe side effects, which might be pain or bleeding, by 70% or more. So men don't need to fear to come forward anymore to get themselves checked. But it's not just things like prostate cancer here, the new proton beam centre in Manchester that we've seen coming forward, CAR T therapy, where we take patients' cells and genetically reprogram them and then inject them back into them to transform the way their cancer is treated. But there are gadgets and gizmos too, and I have some of them here.
Explain.
Yeah, here with me. So this device is a device for biopsying the prostate gland. So at the moment, that's undertaken often with perhaps 30 samples being taken from the prostate and done under a general anaesthetic as a day case. This device, which is our new template biopsy system, is on our National Innovation Accelerator, and this has taken it from a general anaesthetic and a day case procedure to a local anaesthetic and often outpatient procedure, reducing complications and reducing costs and helping us so when those extra patients come forward wanting the test, wanting to be checked for prostate cancer, the NHS is ready, adopting this latest, greatest technology.
And going back to the gel, I mean, in some ways it feels quite simple. You know, it's a barrier, isn't it? It's a space. You call it a spacer, don't you? But it's quite a simple answer to what is, you know, clearly a really important issue.
Absolutely. So I am a consultant urological surgeon in Southend Hospital down in Essex, so I deal with men with prostate cancer day in and out, as well as my role at NHS England in how we adopt the latest, greatest innovations. And when the hydrogel came through, I looked at that and just said, this makes surgical sense, removing a tissue out of the radiation field so it doesn't get damaged. As you say, so simple, so effective, and through our innovative technology payment system, we're making that available across the NHS so men can come forward and not necessarily have the side effects that they might have done. But prostate cancer is a really important thing, and as we heard, 40,000 patients a year. But do you know there are probably 10 times as many men who have benign conditions affecting their prostate that they're afraid to come forward with?
Listen, our time is up for now. You have a fascinating job, and it's really interesting hearing the detail. Thank you so much. We'll talk again another time.
Okay,
Thank you.
thank you.
Professor Tony